training video regarding how to do a starter care oasis documentation. This is now effective January 1st, 2023 because it's the new Oasis E. So everybody has to watch this training video. A lot of sections are going to be similar to the old stuff that we were used to, but there are some new sections in here. So I'm going to take the time to kind of go over this and try to help you figure out exactly what you can skip when you're documenting and what you can't skip. And I'm going to kind of do this live with you so you can kind of get an idea of how long it's going to take me as well and how I would answer these questions. So to start off, you're going to notice you're going to get these COVID 19 questions, which in all reality, all these questions should be no for you to proceed with the patient. And then you go next, you're going to see the patient information. Past medical history, obviously that you can always get from the HMP that's usually attached in the chart. And then if you want to write anything else, like the patient told you, history of stroke, for example, you can put something like that. If you want to talk about their old therapy history, you can. You don't have to. If there's a specific diagnosis you want to add, you can also choose one. Otherwise, it's like a muscle weakness. This is important, the homebound status. You want to select this as many as you can. So most people tend to use an assistive device, taxing effort to leave the home, maybe, if they have any kind of restrictions or severe shortness of breath or anything like that, you can select as many applicable things as you like. Prior level of function, you can always say something like, they were independent. And then surgical history, maybe this person has a left total knee arthroplasty on December 31st, for example. And you can state something like that. It's okay if you don't have everything filled out. If you forgot to get the hospitalization dates, which tends to happen. This area right here, I would say skip it. I don't want you to worry about the patient information or their Medicare number or anything like that. It should be already pre-populated the way it is. Don't worry about that. You do have to start paying attention as soon as it gets to the ethnicity question. Now, if they want to answer, they can answer. If they don't want to let you know, then you can just say patient declined to respond, or you can maybe say they're not Hispanic, whatever the question is. Same thing, again, we've all done these questions on some forms or another. Are they white? Are they Hispanic, Vietnamese, etc.? If they choose to decline, you can put patient declined to respond. What is your preferred language? I mean, this one's pretty simple. I mean, maybe it's Spanish or English or whatever language the patient's speaking. Do they need an interpreter? You would say no, but of course, if they need to, you can put yes. And then if that's something but I would put no for most patients because more than likely you're not going to have an interpreter with those. And then it goes into questions about transportation. Is the lack of this is kind of the new stuff that's added to SOC. The lack of transportation, is this affecting you, from getting to work, et cetera, et cetera. So maybe they say, patient declined to respond, or maybe they said, no, it's not transportation. I have my son with me that can take me everywhere. Or yes, because of my transportation is such a big issue. Yes, transportation is an issue, and that's why I can't go to outpatient. I don't drive anymore and I have to rely on Uber. So in this example, yes, it's kept me from medical appointments or from getting my medical attention as far as transportation because they can't drive a car. Source of payment, I don't want you to worry about that too much. If you want to, you can always select your Medicare, and then the office or the agency will change it. You can skip this. You don't have to worry about this so much as well. But unless you want to and the patient indicated they have a representative that does everything for them, you're more than welcome to add that information. This is really when you need to start filling out everything. So we're going to go here. I did my assessment. Let's pretend it's today. And then it's the start of care. Date for the physician's order start of care. Usually that's on the HMP. And so if the patient was discharged for a total knee on December 31st, I'll put that. I usually put the term early. This is a new section. Okay, so again, for those of you that are new to the Oasis E, what this is asking you, special treatment or procedure or program. Does this person that you're evaluating have any of these issues? Do they have cancer treatments? Do they have respiratory therapy? or anything like IV medications or antibiotics or something going on. So as you know, you're getting the medication list with a lot of these patients. Really, the only thing that I would probably pay attention to, for the most part, is you'll know right away if they have cancer, and they'll let you know. So you can select what's appropriate. If they're getting kind of respiratory therapy, you're gonna notice they're gonna be on an oxygen machine, or they're gonna have some kind of a COPD diagnosis, and you can kind of select whatever is needed. If it's oxygen is needed, you can select that. And then most patients that we get, they might have dialysis or hemodialysis, so that can be an option that you can select. Or maybe they're on an antibiotic medication if they just were discharged, because most antibiotics is a 10-day, maybe up to 3 weeks, depending on the diagnosis, as far as how they're taking it. A lot of them might take an anticoagulation medication. This is the part for therapists. It's going to be hard for us because we're not really pharmacists and we don't know medicine maybe as well as nurses. So do your best to answer these questions, okay? But you want to ask this kind of information. So this is going to come from your medication list, whether it's an antibiotic, anticoagulation, or dialysis. And then you just, if it's nothing, if they have none of these, then you just show none of the above. And you're going to put on admission, this is at discharge. So really, right now, we're worried about the first column. So if I think my patient, I know they were taking antibiotics, so I can take antibiotics and select that one. That's the only thing that they were taking that was important on this list. So that's all I'm going to select, and I'm going to move on. The next thing is, was this patient discharged from a hospital, or what was going on? So you can put something like, yeah, inpatient discharge or rehab hospital. Weakness, in this example, we're going to go with like left total knee arthroplasty. You do not have to do this, so you can just skip that part. Other diagnoses, you can add more. If they're like diabetic or COPD or anything like that, you can go ahead and check that. For this example, we're going to say our patient is diabetic, so we're going to go ahead and select that diagnosis. Again, this is now PT stuff. Why is this patient homebound? This is very similar to what we select earlier. I know it's kind of double the work, but unfortunately, that's just how it is. So you kind of select this stuff again. And then you don't have to answer every single question. You don't need to answer this. If you have it, great. You don't have to go through the immunization and ask them, have you had your influenza or your HN1? You can skip that question. Risk for hospitalization, that one is important. So someone like my patient, I might put something like multiple hospitalization. They are taking more than 5 medications, and other risks that maybe are not listed here, like this person is diabetic and it's not listed on here. Maybe they have congestive heart failure, it's not listed on here. So I can list something like that, and that just kind of scales them. And don't worry, this is just telling uh, the person reviewing this document the risk for hospitalization. Directives, if you know they have a living will, great. Prognosis, what do you think, right? So you can put good. Height and weight you need. So you can obviously in inches, so you can always say this person is say 5'8", so you can put 68 inches. Maybe they're around 170 pounds. And again, this is a new section now. It says nutrition approaches. This wasn't there before. It's asking you, is this person following any of these things? A specific diet like low salt, diabetic, or cholesterol? And you just ask them, do you follow any specific diet, or do you just eat what you want? Maybe my patient told me, I am diabetic. I try to reduce my diet, reduce my carbohydrate intake and whatnot. So maybe I can check something like that. If not, I would put none of the above. Subjective, just type what the patient tells you. Patient reports pain in left knee since surgery and unable to ambulate without walker. And anything else that the patient might tell you. You don't have to write a lot, whatever the patient reports to you. And of course, as you know, you always have to take vitals with every single visit that you do, regardless of if it's a start of care. So for this example, we're going to go ahead and put the patient's vitals as well. So you put heart rate, blood pressure, respiratory rate, and then you just put the temperature because of the COVID situation that we're still in. You'll put those vitals, and then here you just kind of put, again, this is all the same stuff as the last SOC. Maybe patient lives alone, but he has someone that can help him regular daytime. And then in the facility, no pain level. Let's say he does have pain in the left knee, so we're gonna put he does have pain. We'll put level is 3. We use 0 to 10, and I try to move as quick as possible when I'm doing these notes. And then so continuous, if we want to, it was 3. Worst pain, we asked them 5. Best pain, 1. Type of pain, achy pain. Simple as that. What makes it worse? It hurts when he moves. It helps when he rests. And maybe he takes medication. Your ags and eases. Modalities, no. If you forget to leave it, answer it. It's not a big deal. Frequency of pain. He says he's getting it all the time, so he can put all the time. And then these are questions that were part of the old oasis. Is hearing adequate? Yes. They can hear fine. They can see fine. Literacy, sure, never a problem. They can read everything they want. If they need help, like somebody has to read for them, then you can just select whatever is appropriate. And then, no problems in this case. Nose, no problem. Throat, no problem. Mouth, no problem. Ears, no problem. You just kind of, obviously, if you notice, the patient's going to complain. You can always ask them, is there any ear, nose, throat problem? And they'll let you know, oh, I have a cough, or I have this, I have that. But this stuff is just, if it's really serious, like deaf or whatnot. Endocrine. So is the patient diabetic? I'm going to put yes in this situation. Explain, because the patient's diabetic type 2. And I'll put here, and then so I'll open up a window, and it's asking me more question now. Now I don't have to answer all these questions, right? I'm just going to put that this patient's type 2, and is it controlled? And yes, he was telling me he does he takes his diet, and so we'll maybe say something like that. And that's really all I'm going to answer in this question. I'm not going to really go into anything else. It's monitored by the patient, and that's it. Now, I don't need to answer any of these questions, so don't feel like you have to. And then you go to sensory. Usually in this situation, you can say everybody's normal. For physical therapy standpoint, I always say the posture and the activity tolerance is abnormal, because most of my patients are not in great posture, and they're not normal as far as their activity level. They're fatigued, or they're limited in their distance that they walk. In this example, I put edema as abnormal because the patient just had a total knee. So we're going to use that example for us. And then, he's alert and oriented, so I have no issues here. Skin, is the skin, anything disorder going on or anything like that? And I can put like no problem, right? Or I can maybe put something as, if I want to talk about the wounds, I can comment on it here, but there's another section for it. So usually I just say no. Here, I know my patient was, standing up, walking around with a walker. He doesn't have a pressure sore. I already know that. So this is information that I'm also going to infer. So you don't have to ask these questions during your SOC. You're literally going to just sit here and answer these questions no, especially if you know that the patient doesn't have anything. Now there's a question about a wound. Yes, the patient at least has one observable wound, but not observable because it has a dressing on it, which is mainly happens after a total knee replacement. So that's the option I would select. They have a surgical wound. It's covered with dressing. I didn't look at it. I didn't do any wound care, so I don't have to worry about that. Gait training. So let's just pretend that he did about 50 feet. I would advise on the day of the start of care not to ever put a number more than 100, because remember, this is the first visit. You want to ask for maybe 7, 9 visits, however many you're asking for. If you put the patient independent in this section, it's going to be a red flag. Or if you say they're walking 300 feet, it's going to be a red flag. So you want to limit this to less than 100 feet, and you want to stay at contact guard assist or min assist. Maybe you can put standby assist, but I would avoid, supervision or independent or modified independent, because it's just they're not going to get approval for any authorization. Now you go into posture. You can put something like slow cadence, right? Limited weight bearing on left lower extremity, whatever you want to write on it. Stairs, maybe not tested in this example, right? Too soon. So we go on. Upper extremity, I can say, range of motion to upper extremity is fine. MMT was tested as 4 out of 5. This one I can say left range of motion, -8 to 60 degrees, for example. And then you can say right range of motion for knee is within functional limit. MMT on left, you can say something as 3- out of 5. because obviously he just had surgery, and then MT on right is maybe 4 out of 5. You move on. Balance, again, whatever you think, you just kind of put this in what you think. This is kind of simple standard with most of my patients that I find. This tends to be the scale for some reason. Shortness of breath, I tend to, most of my patients also, they report if they're walking up, a flight of stairs, they get winded. And then here it goes into an order of cardiopulmonary. Is there any issues? I ask them, do you have any issues at all? They might tell me, you know what, I do have some hypertension. Okay, great. I'll put that down. That's it. I don't need to answer all this other questions. Pacemaker, they said, no, I can answer it. I don't have to. O2, they're not taking it, or I can move on. Do I need to address nutrition? No, I don't. Patient said it's fine. Any internal feedings going on, like colostomy bags or anything happening? Nope. So I can put wound care. Did I do anything on wound care? It's optional. Just leave it blank. It's no problem. Instructions. Did you give them anything? Yeah, I talked about some safety measures. Maybe I talked about fall risk, H&P, how to use the proper equipment, ADLs, whatever it is that you talked about, range of motion limitation, something like that. And then as far as elimination, do they have urge frequency? Are they using diapers? In this example, my patient's fine. I can just put no problem, right? And then they just asked me 2 more questions. Did they have a UTI? No, they didn't. Do they use a catheter or anything? No, they're not incontinent. Okay, great. I can move on. Same thing. Do they have any bowel incontinence? If they do, I can always put like they're constipated, or I can put a comment on here to use diapers, but they don't have an issue, so I can move on. Bowel frequency, incontinence, they're not incontinent, so there's no problem there. Patient doesn't have an ostomy bag. So you just have to answer the questions and move on. Any abdomen issue? No problem. I can just close that window. Any neuro issue? In this example, we didn't, I think we put earlier, history of stroke, right? So we can put stroke from 2010 with slight, I'm making this up as an example, right-sided weakness. So you can put something like that if you want to. And you can answer more questions if you want, or you can just say it wasn't applicable in this example. The patient's alert and oriented, so I'm not worried about that. Are they confused? I was having a great conversation with them, so I don't need to, answer these questions. It's really self-explanatory. I didn't really have to answer anything. This is where the new oasis comes in, by the way. So this is the area where it's going to be new to everybody. It's all about cognitive. It has nothing to do with physical therapy, unfortunately. Or occupational therapy or anything. They just want you to find out a little bit more information about these patients regarding their retention of memory and whatnot, their mental status. So it says here, in case you can't do this interview with this person, for example, this person does not understand you, they have no communication, they cannot go through the section at all, you're just going to put no, and it says you're just going to skip to this question. You're going to skip to C1310. But for the sake of this training, we're going to go through this. So in this example, we're going to say, yes, we continue with these words. They want you to say 3 words to the patient. I'm going to say 3 words, and you want them to ask if they can repeat it back for you. And the 3 words are literally this: sock, blue, and red. And you're going to say sock, blue, and red. And you're going to say number of words repeated after the first attempt. You're going to ask them, can you repeat what I just said to you? And then they say sock, blue, red. So great. They said all 3. Maybe they said sock, blue, and they didn't say bed or whatever. So that's how it would go. So based on what they answer, you go from there. And then you're going to say, ask them, please tell me what year is it right now? And then whatever they answer, and you can just say correct, for example. Okay, great. Are they able to say the correct months? Yeah, missed by greater than 1 month, missed by 6 months, or accurate within 5 days. So you put accurate in this example. What about the week? It was correct. And then it says here, let's go back to the earlier question where there was the words of the color, right? And then you can just ask them if they're unable to remember that word. So you can say something like that, like something to wear, or a colored piece of furniture. And then you just kind of want to retest them. Now, I know what everyone's going to say, and it's going to be kind of annoying doing this because it's not really part of your scope of practice so much. But it is something that they're requiring it for. So if somebody, answered all these questions correctly, then you can go ahead and answer, yes, no cue required, yes, no cue required. If you have to cue them, you can say something. So, and that's kind of how it goes. This score right here, I obviously tells you put 99 if the patient's not able to interview, and then you felt the score. I will find out. This should be pre-populated for you, so I don't want you to worry about this so far. If we have to, then we'll let you guys know what you would put in there, and then it asks you a question about like signs and symptoms of delirium. If after a brief interview, mental status and whatnot. Is there any evidence of acute change in mental status? And you would just say no in this situation. Did the patient have difficulty focusing? And maybe you say um, behavior is present, fluctuates, comes and goes, whatever you want to say, or behavior not present. So, for example, being easily distractible. So if the patient is okay with you, then everything's okay. This organized thinking, you'd say not present. Again, it's only if the patient's presenting with like a really weird mental status, then you're gonna maybe want to get nitty gritty with these questions. And then I'll ask about the mood. Over the last 2 weeks, have you been bothered or any of the following problems? And this is pretty much if it's a lot about your depression kind of questions that they ask. So you're just gonna again answer a lot of this. You'll be able to know that most of your patients are gonna be able to respond to you and say everything is okay, like their memories is fine. It's only the ones that are going to give you they don't remember or they're in a memory care unit, and if that's the case, more than likely a nurse would be doing the SOC, I hope, and you guys don't have to worry about this part. But in this example, you would just say, you know what, patient's fine. Like they're not complaining of depression. They're not complaining that they have little interest of anything. And if you notice earlier, we also answered these similar questions about depression or whatnot. And he says here, add scores of all the frequencies in column 2. Now, obviously, we put 0 in this example because the patient didn't present with anything. So you're just going to put 0 here. Social isolation, never. In this problem, there was no issue with memory. Again, it's still cognitive. And you put frequency done, behavioral systems, never. And that's it. This section that I just covered is what the major change was for Oasis E. Everything after this is exactly like it was before. So we go through it, and you'll notice objective. I didn't really do any specific objective for this test besides what's in here, so I can put non-applicable. Patients oriented, psychosocial, primary language is English. I skip all this. I don't have a problem with it. Musculoskeletal, yes, I'm going to put left total knee arthroplasty here. I'm going to select weakness, lower extremity, decreased range of motion, for example, right? Functional limitation, ambulation is an issue, right? Activity tolerance is an issue for this situation. Grooming, it's asking me, can the patient do everything, able to groom? Yeah, but they had a total knee, so I can't put 0. They still need kind of things to assist them, right? They're just fresh out of the hospital. Because are they able to go into the bathroom and grab their blow dryer and bend down and plug it in, and maybe if it's a female, for her to do her hair the proper way? More than likely not after total knee replacement. So you kind of want to play around with this. So maybe someone's assisting. What about upper body? Well, they can probably dress their upper body, but can they go into their closet and get everything they need to do? So maybe they just need their clothes laid out for them, and then they can do everything from there. So that can be an example. How about lower body? They just had a total knee. So more than likely, they're going to really need help with their socks and shoes, right? So someone has to help. What about bathing? Well, the first couple of days or the first couple of weeks, sometimes it's tough. So they're able to participate in bathing, but they need somebody there perhaps because the wound might get wet or they have to put a bag around it. So you have to kind of base this. Always go with the most debilitated one, right? So if you feel like, nah, they can kind of do it, but I'm not quite sure, at least give them, that they need some kind of help if it's a start of care because it's the first visit. Toilet transferring, they can do it when reminded, assisted, or supervised. Maybe somebody just has to be, contact guard assist with them. Toilet hygiene, they're like, I can do fine as long as, supplies are laid out for me. Like I can't go get the supplies, but as long as they're there, I can do everything I need to do. And this is your basic PT stuff, right? So this is just what we all know how to do, which is just what is this person's situation, and you give them. Maybe I didn't test the car. Log roll, maybe he's standby assist. Sit to supine, he's contact guard. Scooting or bridging, maybe he's standby assist. This is something that you can kind of do like that. Transferring, maybe he can transfer with or without assistance, right? That can be the option. And then as far as here, this is prior level of function. So more than this person is independent. So I can put he's completely independent prior to this surgery. And right now, prior device used, not what he's using now. So he wasn't using anything, so none of the above. And then here again, it's pretty much the PT stuff, somewhat PT, and it's gonna ask you to use this scale to decide what you want. Is it a min assist? Is it a mod assist? Is it independent? That's the scale that you use. So in here, you're gonna say, okay, you know what? I tend to say 5 is somebody's gonna help me. 4 is like supervision, contact guard. 3 is like my mid mod assist. And then okay, so just so I can kind of get an idea, this person he's a 5, right? And then I'm hoping when he's discharged, he's gonna be a 6. He's not gonna need anybody to lay out anything for him. Toilet hygiene, he can do a lot, but he needs somebody to lay out some stuff. Shower, bathing self, he's probably a 4 on that one. We'll make him a 6. Upper body was kind of the same thing as far as dressing. Lower body, he needed some help. Maybe he was a 3. So we make him a 6 as well. Putting on, taking off the shoes, that might be tough for a total knee. So again, we put it as a 3. And then here, based on your assessment, you're just going to run and give this person. Now, I would advise you guys, be very careful with using anything higher than a 4 on this scale, because then the patient will not get the visits that you want them to get, because they're going to think the person is very independent. So again, you're better off going something like, let's put a 3 or a 4 or something like that. And if it's not tested, I can just put, you know what, not tested, because I think 10, not attempted due to environment. You know, it was raining today. I didn't do a car transfer, so I'll put a 10. And then here, maybe, you know, he's a contact guard assist with walking for this example. So I can put a 4, and then I'll move that way. And you can do as many as you can. Let's say you get to here and it wasn't attempted. So maybe I put a 10 on here, but my goal is still for him to be a 6. And I also didn't attempt the stairs due to the environment. So maybe I'll put a 6. I still have to answer the questions. But maybe I didn't attempt it, but I still got to put a goal for it. And then, yeah, so here I didn't attempt, I'll put a 6. And then we go that way. Picking up objects, same scenario. We didn't try it maybe because it's a total knee. We didn't want to practice that right away. So maybe for those examples, I'll put a 6. No wheelchair, so I'll put a 0 here. I'll skip these questions. I don't need to answer. They don't apply because he doesn't have a wheelchair. Patient's able to walk with supervision all the time. Again, I avoid up here on the day of my eval. I try to stay within this range to make sure my patients get their visits. Insurance doesn't give them a hard time. They can able to feed themselves, but they just maybe, again, need some help. Assistant supervision or any other meal setup. Yeah, so maybe they need someone to cook for them right now. They're just out of the hospital. Fall risk assessment. Maybe you did a tug. I don't know. And maybe you got 16 seconds. So you can just put that score right there. You prescribed exercises. You also tell them about the walker. They have no allergies. Again, high-risk drug classification. Well, he was taking antibiotic. We talked about that. That's about it. Maybe he's taking pain pills. There's opiates. It was there. Maybe he was taking, more than likely, antiplatelets, because those are things that tend to be given to patients after total knee replacement, because that's just what doctors prescribe. So this is something that you would check. If they're not taking any, you would put none of the above. So meaning you have to pay attention to the medications that you're writing down, because someone's going to review it. So you can't just put, oh, yeah, no, he's not taking any of these. And then we look at the list and there's an antibiotic and opiates on there. So you kind of have to know that. In this situation, they're just asking you about drugs. Has the patient given any special instruction for high risk medication? You can put something like, no, he wasn't given any special instructions. Can the patient take medications appropriately? Yeah, patient's fine. What about injectable? Well, there's no injectable medication, so I'm going to put no injectable medication prescribed. But for oral, I can put he's able to take it just fine. Oral medication, he's independent. Injectable, he doesn't have any, so it's not applicable. And infusion therapy, I'm just going to put non-applicable. I can close that whole menu. And then here's asking you about, for caregiver, it's for due to cognitive impairment. Remember, this patient is not cognitively impaired. So I'm going to put no problem. What about for ADLs? Well, that's different. ADLs is like, our basic ADLs. So maybe he does need some help. Maybe he needs 3 or more times a week because his wife or whoever has to help this person. This is therapy needed. Well, I tend to write just a total amount of visits, I think. Well, maybe this person will need 9 visits for me for PT. If I know OT, I can write OT as well, but I can put PT 9 here. And then as far as, sorry about that. As far as the patient caregiver education, I can put something like satisfactory return to demo. Does the patient have any action of disease system exacerbating? No. I can understand information? Yes. Skilled care provided, I can put SOC oasis. Usually I put that on this situation. I'll go into more details if I'm doing a lot of treatment, but oasis is already large enough on its own, and so I can select whatever I select in this point. Now you got to select something. You can't leave it blank, but you would select all that's applicable for this specific example that we're doing. Assessment, you can just write it here, blank, good. Physical therapy is what we're doing here, so we move this. This already we did this earlier, so it's already pre-populated. If you want to coordinate with someone, you can put the PT as a PTA, and then you move forward. You go next. This is when you type in your exercises. So maybe you gave them some quad set, maybe you give them some LQ, you give them sit to stand, you gave them heel slides, all right, and you're like 3 sets of 10. I tend to write my exercises that way. I do not have time, neither do I want to select all this stuff with the pictures and images. I personally don't do that because this takes too long to document. So, and then here, regarding the frequency calendar, this is technically where you want to, now we still have to get this approved. Remember, you might want to think, I want to do 1 week 1, 2 week 3, which is 1 week 1, and then 2 week 3, which is doing this. But I want to make everybody understand something. This is just what you want. Insurance has not approved it yet. So you can do this part, but regardless, this is going to change. It might change based on insurance approval. And I would advise you that you can plot your visit based on the frequency that you think you want. You're like, okay, well, I'd like to come back and maybe see this patient for a reassessment on this Thursday, January 26th. And I can plot my visit here in advance already, and it's right here. And I can just move on. And that way the PTA can see the patient, and I will come here. Now this visit might get moved in case there's missed visits or something. I don't know. It's not stuck in stones yet. I just set in stones yet. I just have to plot something for myself for now, and then move on. And then this is your section for your goals, right? So I would usually say something as like, I don't know, 4 to 5 goals. So let's say my goal for this person is 400 feet. And you can say 4 week, 2 week. You can update that. If you want to make this 3 week and 6 weeks, you can. That's up to you. You can do whatever you want. And I can put long term, and maybe I have a short term goal for 200 feet. And I don't, even no assisted device, that's my goal for this person. What about balance? Maybe I have a balance goal for standing dynamic to become a good minus because his balance wasn't that great. And then I can also put a goal as HP and this one. I'm pretty much showing you guys the easiest goals that you can kind of select very, very fast and move on. Now, you can write specific goals if you wanted to at the additional, where you can put something like range of motion will improve from 0 to 110 degrees. Whatever you want, you can write. But for this example, I just want to put something. Here's to say discharge planning. So at the end of plan of care, you just type in, what do you want to work on? Well, we're going to work on strengthening of lower extremity, improve range of motion of left knee, gait training, right? Stair training, perhaps. And you can maybe keep it at that, simple, and just move on. You don't have to write a long essay or anything, just what you can. If you want any additional forms, just so you know, for all of you when you do Discharge Oasis, this is what's called a nom-knock. If you select this example like that, it will actually have the patient, when they go and sign, they will also sign the nom-knock for you, which is really cool. Most agencies will allow that. Some agencies don't allow it, like Pegasus, which they want you to use their own nom-knock. This is where the patient would sign. You would hand your phone to the patient, and the patient would sign here. And then you go next. Now it's your signature, and then you can just sign here if you want. And then you can go to the file, and then this is just the date. And then you would put, in this example, 1/3/23, and then you move on. And obviously, this is the time in and out. So if you were there at this time, then great. You can just push next. If not, you edit it. Verbal order, you don't have to do anything here. You push next, and then you go into here, and this is going to be now your last screen. I've done everything accordingly, so I can finalize my note. If I left something blank, it will be in red right here, and this button will not be green. I would not be able to finalize the note. And this is my note. This is everything I did. And I can now just push finalize. And once I do that, you're done. I'm back in my patient chart, and if you notice, here's my start of care. It's pending approval. My reassessment, I scheduled it for this day. It might be moved. And I'm here, and it says a nom-knock was done by Mina Hanna. So let me show you something about the nom-knock just so you guys can see it. If you clicked on my SOC visit, look, the nom-knock's right here. I open it, and this is what it needs. And the patient's signature, just because I drew a line for the patient, is actually right here. So this got signed by the patient just by clicking that box. So that's kind of really cool to make the process easy, very fast for you. And the last thing that you would do for the specific patient, based on your recommendation, right? You're gonna write a therapy order, and that's when you do something like this. So I think we used the 1 week 1, 2 week 3 example, and our eval, our start of care was today. So and then you can put a medical justification of why you're giving this person PTs. It can be something like, impaired range of motion and impaired strengthening, or whatever you want to write. We have a template that you can kind of use as well. I won't go over this because there's another video explaining this anyway, but that's what you can write. 1 or 2 sentences here, and that'll be good enough. And then you just, again, sign and date it and finalize it, and then that'll be it. If anybody has any questions, feel free to contact me directly. You guys know how to all reach me, or you can reach the office. I hope this video helped, and I hope it's not too long. Thank you, and have a great day.